Welcome to our new session. Today we will learn about aortic dissection. Aortic dissection is a very important topic in cardiology and it's also very important topic for the exam. It is very important for not only for the MRCP part 1 but also it's important for the MRCP part 2 exam. So we'll learn today about the aortic dissection. Actually, what is aortic dissection? Aortic dissection means there may be some breach in the aorta, and that is the rupture of the intima in the blood vessels of the aorta, and blood may enter into the tunica media. When this blood will enter to the tunica media, then it will form the aortic dissection, and it has many devastating complications as well. So, what is the type of the aortic dissection? Aortic dissection may be two types. That is, more common classification is the Stanford classification. It may be type A or type B. In case of type A, that will involve the ascending aorta, and it is the more common form. And in case of type B, there would be in the descending aorta or in the distal to the subclavian origin, and it is less common. So, as I was telling to you that in aortic dissection, the blood will enter to the tunica media of the aorta by rupturing the tunica intima, and when it will appear in the tunica media, it may rupture and bleeding may occur from this side. So in aortic dissection, what will have the patient will present to in our hospital. Usually patient may feel very severe retrosternal chest pain, and that is crushing chest pain, and it will happen within a few minutes, and this pain may radiate to the back, and as well as patient may come with the collapse. So in briefly, if patient have severe retrosternal chest pain and it is crushing in nature and it radiates to the back, or patient may have collapse, so we'll think about aortic dissection. So the question is, why will we will take it very seriously, this aortic dissection? Because it's a devastating condition. If you can't treat this patient very properly within time, the patient may die. So it's very important. So in aortic dissection, what are the association of this disease? Like if the patient has hypertension or trauma, like if you do any catheterization or any other trauma, that may cause the breach of the tunica intima, and it may cause aortic dissection. And also if the patient has some congenital disease like bicuspid aortic valve or any collagen disease like Marfan syndrome or Ehlers-Danlos syndrome, then the stability of the tunica intima will be very weak, and the formation of aortic dissection will be very easier for this patient. And also if the patient has Turner syndrome or Noonan syndrome, or the patient is pregnant or has syphilis, it will be very easy for him to form this disease. So these are the associated disease that will occur with the aortic dissection. So if the aortic dissection occurs, how we will investigate this patient? How we will know that this patient may have aortic dissection? So first of all, the investigation of choice for aortic dissection is CT or pulmonary angiography. It is the gold standard investigation for aortic dissection, and this investigation is very important for the exam. In exam paper, it will be asked to the examinee that what is the investigation of choice for the aortic dissection, and the answer will be CT or MRI angiography. So in CT or MRI angiography, as you can see in this picture, there will be a breach or the dissection area can be seen very easily. Okay, see, this is the dissection. Okay, so primarily you can do chest x-ray of this patient, and this will give you some clue about the dissection, like the broadening of the upper mediastinum. As you can see in this chest x-ray, there is the broadening of the chest x-ray upper mediastinum is there, and there may be distortion of aortic knuckle as in this picture, and there may be some left sidal pleural effusion or hemothorax as you can see in this chest x-ray. So if you do ECG of this patient, you can have the left ventricular hypertrophy due to chronic hypertension or any other disease, and importantly you can have patient may have inferior MI, features of inferior MI. If there is any backward tear that may involve the right coronary artery, and this patient may have inferior MI features. So in case of inferior MI, always you have to look for any other features of aortic dissection, because this inferior MI may be a complications of aortic dissection. Okay, and the last thing is that you can do echocardiogram, and in echocardiogram you can have the aortic regurgitation, dilated aortic root, and flap of dissection. So these are the investigation, and these investigations are very important for the exam. So now what are the complications of the aortic dissections? So in case of aortic dissection, this tear can be occurred in forwardly or backwardly. If this tear occur in backwardly, then the patient may have aortic regurgitation and inferior MI, as I was talking about this, and the patient may have cardiac tamponade, very important complication and very devastating too. If the blood that displace the blood from the blood vessels from to the actually in the pericardium sac, then this will cause cardiac tamponade. And if this cardiac tamponade occurs, you have to treat this patient very rapidly with immediate surgery. Without surgery, the patient may die. Okay, so always think about the complications of this disease. Now, if the complication occurs forwardly, then the patient may have unequal arm pulses and blood pressure, patient may have stroke, and patient may have renal failure. So these are the complications, but backward tear complications are very important for the exam, always remind it. Okay, now what the treatment of this patient? Before treatment, we have to think about whether the lesion where it present, whether it is type A or type B. Type A means, we were talking this, type A means ascending in the ascending aorta, and type B means in the descending aorta. If it is in the ascending aorta, so you have two options. Like firstly, you have to control the blood pressure by labetalol, then you have to do surgery. But in case of type B, the only one option is available, that is control of blood pressure by the labetalol. Here surgery has no any role. But in case of type A, that is more common, you can do surgery. So these are the all about the aortic dissection, very concise in this topic I'm presenting here, but all the topic I was talking about this patient, about this topic is very important for the exam. And the last thing is that the thrombolysis. In case of aortic dissection, thrombolysis is contraindicated. Always remember that. As you have been seen that inferior MI is a complication of aortic dissection, but though this patient has inferior MI features, but you shouldn't do any thrombolysis. It will kill the patient. Okay, so thank you all for your patience hearing. If you feel that this type of lecture is very beneficial for you, you can comment here, and I will make some other videos on different topics that will help you for your MRCP exams. So thank you so much. See you in the next lecture.